As men get older, even small lifestyle habits may influence daily energy, comfort, and overall well-being. Simple routines related to sleep, nutrition, movement, and stress management are often worth paying attention to over time. I'm Dr. Hina Kim, men's health and wellness specialist. And in future discussions, we'll continue exploring practical wellness habits that may support healthy aging for men over 60. Good morning, I'm Dr. Hina Kim, men's health and wellness specialist. Today I want to talk about simple lifestyle habits that may support overall well-being for men over 60. As men get older, it is very common to notice changes in energy levels, sleep patterns, digestion, muscle strength, and daily stamina. These changes are often connected to normal aging, daily routines, nutrition, activity levels, and stress management. One of the most important habits I encourage is maintaining a consistent daily routine. The body often responds better when sleep, meals, hydration, and physical activity happen at regular times throughout the day. Sleep quality becomes increasingly important with age. Many men focus only on the number of hours they sleep, but sleep consistency also matters. Going to bed and waking up at similar times may help support mental clarity, daytime energy, and overall recovery. Nutrition also plays a major role in healthy aging. I often recommend focusing on balanced meals that include lean protein, vegetables, healthy fats, whole grains, and fiber-rich foods. Simple choices such as reducing heavily processed foods and limiting excess sugar may support better long-term wellness. Protein intake is another area that deserves attention. As men age, maintaining muscle health becomes more important for mobility and daily function. Including moderate amounts of protein throughout the day may help support muscle maintenance alongside regular movement. Hydration is frequently overlooked. Some older adults may not feel thirsty as often, even when the body still needs fluids. Drinking water consistently throughout the day may support digestion, circulation, and overall comfort. Physical activity does not always need to be intense. In many cases, simple movement performed regularly can be beneficial. Walking, light stretching, gentle resistance exercises, and staying physically active during daily routines may help support balance, flexibility, and mobility. I also remind many men that long periods of sitting can affect how the body feels over time. Even standing up and moving for a few minutes throughout the day may be helpful for circulation and joint comfort. Stress management is another important part of healthy aging. Chronic stress may influence sleep quality, appetite, focus, and energy levels. Simple calming routines such as quiet walks, breathing exercises, hobbies, or reducing excessive screen time in the evening may help support mental well-being. Digestive health can also change with age. Many men notice that heavier meals become harder to tolerate over time. Eating slowly, including fiber-rich foods, and avoiding overeating late at night may help support digestive comfort. Another area I discuss often is social connection. Staying engaged with family, friends, and meaningful activities may support emotional wellness and mental health as men get older. Routine medical checkups are also important. General health screenings may help men stay informed about changes related to blood pressure, blood sugar, cholesterol, and other age-related health factors. Preventive awareness is often more valuable than waiting until symptoms become disruptive. It is also helpful to pay attention to recovery. The body may require more time to recover from physical exertion, poor sleep, or stress compared to earlier years. Allowing time for rest while maintaining healthy routines can support long-term balance. I encourage men over 60 to focus on steady habits rather than extreme changes. Small improvements practiced consistently are often easier to maintain and may support overall quality of life over time. Healthy aging is not about perfection. It is usually about building routines that support physical comfort, mental clarity, daily movement, balanced nutrition, and long-term well-being. And there are also a few additional daily habits that many men overlook, especially when it comes to maintaining energy and staying active as the years go on. Many men also benefit from paying closer attention to morning habits. Starting the day with hydration, light movement, and a balanced breakfast may help support steadier energy throughout the day. Exposure to natural daylight in the morning may also support healthy sleep patterns and daily alertness. Even a short walk outside or time spent in fresh air can become part of a supportive routine. Joint comfort is another important topic after the age of 60. Gentle stretching and regular movement may help maintain flexibility and reduce stiffness that can develop from inactivity. It is also useful to pay attention to posture during daily activities. Long hours sitting with limited movement may contribute to neck, back, and shoulder discomfort over time. Simple posture awareness and periodic movement breaks may help support physical comfort. Some men also notice gradual changes in appetite as they age. Instead of skipping meals, smaller balanced meals during the day may help maintain steady energy and nutritional intake. Fiber intake remains important for digestive and cardiovascular wellness. Foods such as vegetables, oats, beans, fruits, and whole grains may support digestive regularity and overall health. Limiting excessive sodium intake may also be helpful for many adults. Preparing more meals at home and paying attention to food labels can support healthier daily choices. Caffeine habits are another area worth reviewing. For some men, large amounts of caffeine late in the day may interfere with sleep quality or increase restlessness in the evening. Alcohol intake can also affect sleep, hydration, and energy levels. Moderation and awareness of how the body responds become increasingly important with age. Mental activity is just as valuable as physical activity. Reading, learning new skills, staying socially engaged, and maintaining hobbies may support cognitive wellness and daily focus. Many men also benefit from creating a calmer evening routine. Reducing heavy meals late at night, limiting bright screens before bed, and allowing time to relax may help support more restful sleep. Breathing habits can influence stress levels as well. Slow breathing exercises or quiet relaxation periods during the day may help support a calmer mental state and improved overall well-being. Another healthy habit is paying attention to balance and stability. Simple exercises focused on coordination and lower body strength may support safer movement and confidence during everyday activities. Consistency often matters more than intensity. Very aggressive lifestyle changes are usually harder to maintain long-term. Steady routines that fit naturally into daily life are often more practical and sustainable for healthy aging. It is also important to remember that every individual ages differently. Daily habits, medical history, physical activity, sleep quality, and nutrition can all influence how the body feels over time. For that reason, personalized medical guidance remains valuable, especially when making significant changes related to diet, exercise, or overall wellness routines. And when discussing healthy aging, there is another area many men quietly ask about during routine wellness conversations, especially regarding maintaining everyday vitality and physical confidence over time. As men age, it is normal for physical confidence and daily stamina to change gradually over time. These changes are often influenced by sleep quality, physical activity, stress levels, nutrition, circulation, and overall lifestyle patterns. In many cases, improving general wellness habits may also support broader aspects of daily health and comfort. That is one reason I encourage men to look at the body as a connected system rather than focusing on only one symptom or concern. Cardiovascular health plays an important role in overall well-being as men get older. Regular movement, balanced nutrition, maintaining a healthy weight, and avoiding tobacco products may help support circulation and long-term wellness. Strength maintenance also becomes increasingly important after the age of 60. Light resistance exercises, bodyweight movements, or supervised fitness routines may help support muscle function and everyday mobility. Flexibility and recovery should not be ignored during exercise routines. Gentle warm-ups and stretching may help the body feel more comfortable before and after physical activity. Many men also benefit from reviewing their daily eating habits more carefully. Eating too quickly, overeating late at night, or relying heavily on convenience foods may contribute to low energy or digestive discomfort during the day. Healthy fats are another important part of balanced nutrition. Foods such as nuts, olive oil, fish, and avocado may support general wellness when included in moderation as part of a balanced diet. It is also useful to monitor caffeine, sugar, and highly processed snacks throughout the day. Large fluctuations in energy sometimes relate more to daily habits than to aging alone. Another factor that can influence well-being is hydration during physical activity. Some adults may drink less water than their body requires, especially during warmer weather or exercise routines. Maintaining regular medical communication is also valuable. Changes in sleep, appetite, energy, or physical endurance are worth discussing with a qualified healthcare professional, particularly if those changes become persistent. Medication reviews can also be helpful for older adults. Certain medications may influence sleep patterns, energy levels, hydration, or physical comfort, which is why periodic review with a healthcare provider is important. Mental wellness deserves equal attention. Long-term stress, social isolation, and poor sleep may affect motivation, concentration, and daily well-being over time. Simple daily structure can sometimes make a meaningful difference. Keeping regular meal times, staying physically active, maintaining hobbies, and spending time with supportive people may help create a healthier routine overall. Many men also ask whether aging means they should slow down completely. In most situations, healthy aging is more about adapting routines wisely rather than avoiding activity altogether. The goal is usually to maintain safe movement, balanced nutrition, quality sleep, emotional well-being, and consistent self-care habits that fit comfortably into everyday life. And there are also several overlooked daily behaviors that may quietly influence how men feel physically and mentally as they continue getting older. As we get older, small daily habits often become more important than extreme changes. Consistent sleep, balanced nutrition, regular movement, hydration, stress management, and routine medical care may all support overall well-being over time. Healthy aging looks different for every individual. The goal is not perfection, but creating realistic routines that help support comfort, mobility, energy, and quality of life. I always encourage men to pay attention to gradual changes in their body and discuss concerns with a qualified healthcare professional when needed. Staying informed and maintaining steady wellness habits can be an important part of long-term health awareness. I'm Dr. Hina Kim, Men's Health and Wellness Specialist, and I look forward to continuing this conversation on healthy aging and everyday wellness habits for men over 60.